There are certain medical tests that we need to have done as we age. Now, how has COVID impacted the general public in maintaining their health? Well, to answer that question, we want to welcome back Dr. Pierce from Preventative Diagnostic Center this morning. Good morning, Dr. Pierce.
Good morning. How are you, Sam?
I'm doing great. It's so good to have you on with us again. And preventative care is such a key as we get older in maintaining our health. Now, with COVID being still top of mind for so many of us, how's that affecting keeping up with their health and maintaining their health with diagnostic tests?
Well, with all healthcare in general, we've seen a decline in people going to their physicians for things that they used to just go, for just a wellness check. They don't really feel great, so they might go in to see their doctor. Now, people are trying to avoid that because they're terrified of contracting COVID. In the very beginnings of this, we had people missing surgeries and things of that nature because of COVID. So we've seen this across the realm in medicine, and we see it in our practice as well, because people don't want to come into an office at this juncture because of fear of COVID. And to alleviate that fear, what we have done is implemented all the guidelines, so we still are checking temperatures when people come in, and wearing masks and asking them to wear masks, and cleaning our equipment between each patient. And we have staff that comes in and cleans and disinfects the whole office every night. So we do everything that we can to make it as COVID-free environment as possible.
No, that's great. Now, what are the types of ailments and abnormalities that you can detect normally with the tests you do?
Well, if we do a full body scan, we can check basically from just below the jaw, so from the neck all the way down through the groin. So we could see cysts or growths in the thyroid gland. We can see, if we look at the heart, one of the main things that we look for are calcified plaques in the coronary arteries. We can see enlargement of the heart and things of that nature. If we're looking at the lungs, we can see scarring in the lungs. We can see pneumonia. We can see effects from COVID in the lungs, actually. We can also look in the liver and the kidneys, and we can see cysts, or if there was a solid tumor there, we can see that. We can see issues with the aorta, the main blood vessel that comes out of the heart. We can see abnormalities. We've seen little tumors and growths in the ovaries or the uterus in women. Potentially see enlargement in the prostate, or even prostate cancer. So we have the ability to see a lot of ailments long before anybody would have any symptoms to suggest that they had anything going on.
That's incredible, and it just amazes me how far the technology has come over the years when it comes to medicine and preventative care, like you just talked about. Now's a great time to come and see you guys. You have a very special for couples that might be thinking about coming on in.
Absolutely. It's better than a 2-for-1. We do a heart scan generally for $599 for one scan. We're doing a couple to do the heart scan for each individual for $125 for the couple.
That's a great deal right there. And we have the information on the screen right now, Doctor, for anyone that wants to go see Preventative Diagnostic Center. Such great work there, and such an important part of keeping our health in check as we do age. So, Dr. Pierce, thank you so much for joining us this morning.
Thank you, Sam. Have a wonderful day.
You too.